The Health Department has apologised to the families affected by a chemotherapy blunder at 2 Adelaide hospitals. 10 patients only received half the prescribed dose of a potentially life-saving drug, including one man whose cancer has since returned. Vasil Melandris has more.
Between July 2014 and January this year, 10 seriously ill people were supposed to undergo intensive chemotherapy here at the Royal Adelaide Hospital and at the Flinders Medical Centre. Instead, they only received half the recommended dose of the drug cytarabine to treat their acute myeloid leukemia. That continued for several months and impacted on some patients' second and third round of treatments until a senior clinician discovered the error.
Obviously, we are very, very sorry that this has happened. We treat about 8,000 people have an interaction with one of our hospitals in South Australia every single day. And it is reassuring to know that these types of things are very, very rare.
The Health Department has since contacted the affected families, blaming a typo entered into the internal computer system, and has promised to investigate the matter.
The changes we've put in place relates to improved checking by an independent clinician and an independent pharmacist from the people who've put together the protocol modification before anything's loaded up onto the database.
However, in March this year, one patient, a man in his 60s who had been in remission, suffered a relapse. Legal sources say his family had been tormented by the thought of what might have been if he'd received the right amount of the drug. The man has since received an out-of-court settlement. However, the government says none of the other families are seeking compensation at this stage.